I'm Tiffany Wuebben, and I'm so excited to have you join me today. We're covering a topic that might not always get the spotlight, but is absolutely crucial to a smooth, successful dental practice: managing patient records. Now, I know record management might not sound as thrilling as, say, the newest tech or patient care strategies, but trust me, it's the backbone of everything we do. When records are accurate, secure, and well organized, it benefits your team, your patients, and your entire practice. Today, we'll talk about how to manage patient records effectively, ethically, and efficiently. All right, so why is managing patient records so vital? Well, let's think about this. It's not just about storing information, it's about having the right data available at the right time to deliver the best care possible. Detailed and accurate records ensure a continuity of care, allowing us to track a patient's history, progress, and any critical health conditions. On top of that, well-maintained records are key when it comes to building trust. Patients want to know their information is safe and used responsibly. And don't forget that records are also a shield for your practice, protecting you legally and professionally in case of disputes or compliance reviews. Now, what does effective record management actually look like in the practice? First up, accuracy. It seems basic, but making sure records are documented thoroughly and correctly can't be overstated. Train your team to record every important detail from medical histories and treatment plans to patient concerns and preferences. For example, if a patient mentions sensitivity to a specific anesthetic or material, that needs to be clearly documented. Today, tomorrow, and for years down the road. Consistency is everything here, so having a standardized way to enter and review information is crucial. Next, confidentiality. We live in a world where privacy isn't just a nice to have, it's a must. Protecting patient data is non-negotiable, and it starts with clear office policies and ongoing training for your team. For example, remind everyone to avoid discussing sensitive patient information in public areas and to never leave physical records on desks unattended. And when it comes to digital records, make sure strong passwords and encryptions and role-based assessed protocols are in place. You wouldn't leave the front door to your practice open all night, so think of data security as locking the door to your records. Speaking of digital systems, this is where technology really shines. Gone are the days of bulky filing cabinets. Thank goodness for that, right? Digital record keeping systems offer enhanced efficiency, ease of assessments, and ease of access, and an added layer of security. Imagine this: with just a few clicks, you can pull up a patient's entire chart, flag an overdue follow-up, or attach intraoral photos to their history. Platforms can even handle automatic reminders for routine cleanings or overdue treatments, taking some weight off your team's workload. Plus, digital systems can often sync with other technologies like billing software, giving you a seamless experience across all aspects of practice management. But as fantastic as digital systems are, they do come with responsibilities. Ensure your software updates are current to protect against breaches, and prioritize redundant backups, both locally and in the cloud. If your system crashes, having a secure backup in place is the difference between a minor inconvenience and a full-blown crisis. And of course, make sure your team knows how to use the system effectively. No tool is useful if it's not being utilized properly. Now, what about compliance? From state laws to HIPAA and data protection regulations, the legal and ethical standards surrounding patient records are non-negotiable. Make sure your processes meet established guidelines, like retaining records for the required time frame, maintaining confidentiality, and having a clear plan for records, disposing of them when it comes to that time. For example, if your office is transitioning from paper to digital, ensure that old documents are shredded properly or stored in accordance with laws before making the switch. Staying compliant isn't just about avoiding penalties, it's about maintaining the trust of your patients and standing out as a practice that values integrity. Here's one more pro tip for record management. Build time into your practice schedule for periodic reviews. Whether it's a designated team member or a systemized evaluation, regularly auditing your records ensures that things are consistent, accurate, and compliant. Look for outdated information, incomplete entries, and even areas where your processes could be streamlined. A little fine-tuning now saves a lot of headaches down the road, right? All right, I know that was a lot to cover, so here's the short and sweet version. Managing patient records effectively comes down to 4 pillars: accuracy, confidentiality, efficiency, and compliance. Prioritize detailed and consistent documentation. Protect patient privacy at all costs. Leverage the power of digital systems for ease and security, and stay sharp when it comes to meeting legal standards. Here's your challenge for the week. Take a closer look at your record management processes and identify one area you can improve. Maybe it's updating your digital systems, retraining your team on confidentiality, or setting up a schedule for regular reviews. Small improvements now can make a huge difference in the way your practice runs and how your patients experience care. Thank you so much for spending time with me today. Managing patient records might not be the flashiest part of dentistry, but it is the most important element in building a trustworthy, well-oiled practice. Keep striving for excellence, and I know your patients and your team will thank you. Take care. I'll see you next time.